The Centers for Disease Control and Prevention is the foremost public health agency in the United States. The main thing my division is trying to do is eliminate viral hepatitis. In the United States, about 2.4 to 4 million people are infected with hepatitis C right now. There is not a vaccine for hepatitis C, but there is a cure. And the World Health Organization has a goal of eliminating hepatitis C by 2030. With all the things that have happened at the CDC, we're getting farther and farther away from that goal. A lot of people don't know they have hepatitis C. You will go decades without symptoms, and then suddenly your liver is failing and you will die without a transplant. But with this cure, you can avoid having any symptoms whatsoever. I knew in the lead up to the 2024 election that Doge was going to be a thing, but I don't think it really sunk in that that could affect me. And then I received the email that said I was terminated for performance reasons. I had just gotten promoted and I was set to get a performance bonus because I did so well. And yet I was fired for performance reasons. After you get fired, within a day, they lock you out of your work computer. So that means that all of your documentation, your ability to look at your pay stub, your ability to get your healthcare information, health insurance, all of that gets locked out. So there's this huge panic for weeks. What information do I need? What documents do I need to download and send to a personal computer or my phone or what? The lawyers who were trying to give us advice and help us and do class action lawsuits, they're like, this has never happened before. No one has mass fired probationary employees for, and I'm using air quotes here, performance reasons, which was ironic because almost everyone I know had just gotten promoted. Tons of people are panicking. They just moved for this job. They started a family. I've been on indefinite paid admin leave. I'm technically still employed, but I've been locked out of my computer the whole time and unable to work. It's weird to me that Doge and the decisions that have been made in the sake of efficiency are essentially having me just sit here and do nothing while my job is going undone. With the firing of a lot of people in my division, what should be a 6-person team handling 5 different diseases is now just 1 person. There's a very, very real risk that people with these diseases will go unnoticed and untreated, and it will eventually kill them. So what terrifies me is if the CDC no longer funds this work, there is no one in the United States looking and testing for hepatitis C. It's already an epidemic. It can only get significantly worse. If you wanted to increase the efficiency of the government, there's hundreds of thousands of things that you could do. The very last thing you would do is fire people, because there are folks at the CDC and all over the federal government who have been in their jobs for decades. You cannot replace them with AI. You cannot replace the #1 expert on earth with anyone else. If we stop doing that work, if we stop preventing people from getting sick, the cost monetarily is humongous. As we've seen with measles especially, it would have cost in Texas $68,000 to vaccinate all the kids who end up getting infected. It now costs in the millions of dollars to treat them for measles, and some of them will die. That is an untold amount of human suffering. You can imagine, the cost in millions and billions of lost economic productivity, of whole industries just not being able to find people to work. That's the whole point of the CDC, is looking out for the whole nation's health. And if no one is doing that, you are at risk. One of the big things that I've seen in the media is that for a lot of folks, the federal government is kind of just a bunch of people pushing papers around. But I really want to emphasize the people who have been fired were protecting you from diseases that I'm glad you don't know about. It is a better America if you don't have to worry about those things.